Hi, welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. Well, here we are. We are still in the midst, month 3, 4, program number 40 something, and we are still in the midst of COVID. I mean, it's crazy how this pandemic continues to go on. And with such, I keep harping on key products, and we're going to get into a really key product. This is a part 2 episode of really molecular iodine. We use it in my office. We use it in a variety of different ways. So today my guest is actually, he's a periodontist. He's been using this product and this technology for now 7 years, far longer than I think anybody in the United States, and we'll ask him more about that. His name is Dr. Ari Moskowitz, and with that, as a practicing periodontist in Baltimore, I think this is great because I so believe in perio maintenance. We're going to get into a lot of this, and we're going to talk about COVID too. But with that, Ari, welcome to the show. It's great to have you. Great to have you.
Thank you. Thank you so much for having me. This is I'm excited to share this information with everybody. It's going to be very helpful for everyone.
I love it. So let's talk about first, I want to do some disclosures with you. Tell me your disclosures on this because I know you're very, very clinical based. So let's go through some disclosures if you don't mind.
So my father and some 2 chemist friends of his are the co-inventors of this technology, and I have no financial interest in this. They haven't paid me a dime to date, and I don't know at any point when they would in the future, but I don't have any equity ownership in the business at all. This is purely for academic purposes and to find a better way to help our patients than what I've been using in the past in my practice.
I love it. So let's go right into that. And if you need an agent to negotiate, I'll get you an agent. In all seriousness, let's talk about perio maintenance, periodontal disease, and this molecular iodine. However you want to construct it, let's get into the story over your 7 years of what your findings are.
So, 7 years ago, they came up with this technology, and I knew through my studies about the effectiveness of provodone iodine in managing periodontal disease in many studies over the years, and I thought, wow, if we have this technology that takes the active ingredient in provodone iodine, which is a molecular iodine, which is typically in 1 to 3 parts per million in provodone iodine, and they can concentrate it, 100, 150 times without the toxicity and without the staining that provodone iodine has, that, wow, wouldn't that be a wonderful thing to use to help manage periodontal disease? So it's been a process of evaluating over time, what are the different applications that we wanted to use it for? Should it be an oral rinse? Should it be concentrate put in the water reservoir of the water pick? A gel, that goes into periodontal gel trays that people can put in for a period of time daily. We were thinking what would be something that could help manage this in the most effective way, where patients would be as compliant as possible with that. So it was
Right.
a process. In the years leading up to it, I had used, given people prescriptions for Paradex, chlorhexidine gluconate, either on a regular basis, but that would lead to staining or loss of taste sensation to salt, and so then we got to using chlorhexidine for twice a day for the first week of every month to try to mitigate the negative side effects of it. There was some improvement with that, and then we had them using water picks, and then water picks using the pickpocket tip, which is a special rubber point that's inserted into the tip of certain water pick models, and that seemed to be more effective for getting the plaque build up better in the pocketing, and then we had them add the hydrogen peroxide to it. We even had them add a drop of bleach for some people who weren't responding favorably
Yep.
with any of those other methods. But everything that we explored, there was some further improvement that we saw in the level of control in the maintenance population in my practice. And so we were encouraged by that. And then when this came along, I was super excited. I was like, oh my gosh, this could be a total game changer on this. And let's see how this works. And, the challenge was, getting people motivated and to use things. And when you're in private practice and you're busy, seeing patient to patient, to try to track and monitor and evaluate the results and get feedback on it, and is not always an easy process, because you have to also say, are we looking at a concentration of the molecular iodine, like what would be the most appropriate concentration that we could start to see consistent results of reduction in plaque and reduction in bleeding on probing, reduction in probing depths. And then on top of that, okay, well, we have the right concentration, but is the person utilizing it in the way that's the most effective? Maybe they're telling me they're using their water pick, but they're using it once every 3 days or once a week, or when they feel like they have something caught, in their teeth. And so it took years. It really actually took years. You want to run with this stuff, and you can never run with it as fast as you'd like to run with it. But fortunately, I was busy and distracted with, my 5 kids and my practice. And before I knew it, we had enough information to really to say to us, look, this is an outstanding product, better than anything else, that any other antimicrobial that I've worked with, and it's something that's showing consistent results. And then I saw also improvements in wound healing, after surgery, plaque control for people while they're healing, in terms of applying it with a Q-tip, gently to an area, or rinsing, as an oral rinse. And we developed it into, we have it, there's 100 parts per million mouthwash, and it's the RTU, ready-to-use rinse. They have a concentrated, it's 500 parts per million iodine concentrate solution that they take a cap full of that and put it into the water reservoir of the water pick, and use that with the pickpocket tip on a medium power setting. And that really helps to keep things stable over time. And then we developed it into a gel that you put into these periodontal trays that are custom fit. They're soft and flexible. They extend over the teeth and over the gums, and they create a little bit of a seal around there. So that's every one of those steps. When people are utilizing those on a daily, consistent basis, the results are amazing, and the patients notice it, and that motivates them to continue to use it, which is great too.
So let's touch on a few things. First off, Ari, iodine has been well studied in the literature, whether from slots, and as a periodontist, you know this. I mean, this is not, Ari's figuring this out. I mean, iodine has been well studied for decades about
Guattardi also. Yeah. A lot of great, right.
Great. So I want everybody to realize, yes, we talked about episode 1, COVID rinse. It's a great pre-rinse. The studies have shown that it can actually kill the coronavirus. That was in version 1, but I'm a huge maintenance guy. And here I'm talking to a periodontist, like my periodontist, and he absolutely believes, like I'm assuming Ari does, you come in for 4 hygiene perio maintenance visits a year, and my God, Ari, you really need to up your game to maintain this, to maintain control over periodontal disease. It is just the way it is. So I want to ask you specific questions, if that's okay with you.
Can I just expand on that for a second?
Absolutely, do
I
it.
have to tell I've been in practice. I mean, I've been, like over 20 years, and I have to say there were many times where I felt like I was spinning my wheels. I felt like, I don't want to keep putting people through surgery. I want to get things under control in the least invasive and most effective way possible. And how can I help them to do that? What are the different things that I'm not seeing that I can help them to get to that point.
Right.
And it actually got to a point where I felt like, almost like getting burnout. Like, I don't want to keep doing this, keep doing these surgical procedures to people, and then I got into the laser therapy, and that was a more minimally invasive way. And now with this, like, the level of control, I mean, it's a total game changer. I'm not going to say it's a magic wand. I mean, people still have to use it on a daily basis, but my God, it's so amazing, like how much more it's kind of uplifted my spirits and the patient's spirits, where they're not like, why do I keep doing this if it keeps getting worse?
Right. So I will tell you, listen, I have been involved in this, like your world, since 1982. And as I just continue to learn more and more about perio and maintenance, I mean, I have 3 Lenop doctors who refer maintenance patients to me. So I know that they see the need for this. My own periodontist sees the need. It's almost protocols for implant therapy, post-implant replacement. I'm with you. So I'm going to ask you some kind of, I just want to ask like tip and trick questions. So I've been a Perio Protect user for years. Love this system and I've had great success. Is it 100%? Of course not. Nothing's 100%. And I can tell when patients are lying and they say they're using it and they're not using it. So openly, talk to me. So are you using the gel in the Perio Protect trays and evaluating that as a successful way of doing maintenance? Talk to me about how are they using it 10 minutes a day, 20 minutes a day? What are you advising patients?
I held off on the Perio Protect system for many years because you don't know how much is marketing, how much is the real deal. And then I said, you know what, I got to see what it's about. And a few years ago, I went in and I got on it, and I had so many patients get on it, and I found it was significantly helpful. There was reduction in plaque, reduction in bleeding when they were using it regularly. Of course. Every patient is different about what is the frequency that they need. What is the level of control? What is their, how quickly do they build up in plaque and things like that. So I usually would start off having them go in the first 6 weeks, I would have them do 3 times a day for 15 minutes a day if they were moderate to severe perio disease. And then I would have them do twice a day for the next couple of maintenance cleanings, and then hopefully eventually down to once a day. And so I saw a significant improvement with that. My hygienists were happier because there was less tartar, and whatever tartar built up was easier to clean off. And then when we started to develop the perio, the gel, the Iogel for the perio trays, and we actually partly for convenience purposes, we started off with the patients who were in the perio trays for the Perio Protect, the ones who were still worsening. Those were the ones that I started first with the Iogel in there. And I had them just substitute, whatever frequency they were doing already with the Perio gel, we had them do it with the Iogel, which is the molecular iodine gel. And it was interesting because I was watching them very carefully. It took us a couple of years to develop a gel carrier that would still allow for the bioavailability of the molecular iodine to interact with the bacteria and the organism. Exactly. So because the same carrier gel that is used for the hydrogen peroxide gel actually inactivates the iodine, the molecular iodine, and also other carriers that we tried. There were other carriers that we tried that actually isolated the molecular iodine and didn't allow it to interact. I was seeing people were promising me that they were using it, and I was seeing that it was as bad as if they were doing nothing. And I was like, this cannot be possible. So we kept going back to the drawing board, and I kept going back to Roger and my dad and saying, we got to try something else, and that's where it was like a trial and error kind of thing over years, because it wasn't a systematic thing that we were, I could look at so carefully. And then that's when Roger identified that, well, it wasn't allowing it to be bioavailable. He put the correct concentration, and then he saw that it would show up only when it was agitated, and we can't have people just agitating the gel. So we got it to a point where there's a gel that has wonderful bioavailability of the molecular iodine. But when I had patients who were using the hydrogen peroxide gel switching to this gel is a little bit less viscous than the hydrogen peroxide gel. So when they would put it in, they would feel it run out faster. And so normally they put in the hydrogen peroxide gel trays for 15 minutes. And this they would put in, and they'd come back to me and they said, I'm putting it in, but it feels like it's running out after 5 minutes, it's running out. But yet I was seeing better results when they were using the hydrogen peroxide gel. I was seeing results that were significant improvement over that, even with it running out. And I'm saying to myself, how is that possible? And then I realized that the molecular iodine kills these bugs in 30 seconds, a minute, and maybe in a biofilm in a minute, and it doesn't need 15 minutes. It doesn't need 10 minutes. 5 minutes is enough, but you tell patient 5 minutes, they put it in for 5 seconds. So, 10 minute, I tell them 10 minutes when it comes to the IO-gel, I tell them 10 minutes, using that. And it's definitely been a significant improvement over the hydrogen peroxide gel. And sometimes I'll have people alternating between the two, between hydrogen peroxide gel and the IO gel. And mostly I do that because some of them like the slow whitening effect of the hydrogen peroxide. They notice it. I don't promise that to them because it doesn't happen to everybody. But they notice it and they're like, hey, I like that. So I say, you know what? If you don't want to go all the way to the iodine gel, which works better for controlling your periodontal disease, at least alternate. So that's why I have them, some people alternating, but most other people I have them using it, the IO gel now exclusively because of how much more effective it is, in the clinical parameters.
And let me ask you this then, as far as, we get the rinse portion, we get the concentrate portion. As I close today, talk to me how you see IO rinse and this COVID pandemic applications in your practice. Give me your suggestions.
So number one, we have them come in and we use, they have a product now called IO Cleanse, which is a 200 parts per million with a little bit of surfactant. And that's to disinfect their hands when they first come in. We just spray down their hands for 30. We have them wipe their, rub their hands together for 30 seconds. We give them a paper towel and we bring them back to the operatory. We have them rinse for 30 seconds with 100 parts per million, the RTU, the ready-to-use rinse. And then that's just kind of pre-procedural, pre-visit type of work. And that's even for just, a routine visit. I mean, that's even if a consultation, and that's not whether I'm doing, aerosol producing procedure or not. Anybody comes into the office is doing that. And then as far as, actually doing the clinical work, in the water reservoirs of our dental units for the high-speed handpiece, we pour in directly the 100 parts per million, the RTU, and we also put it into the water reservoirs of our ultrasonic instrumentation as well, so that as we're working and we're generating these aerosols, we are actually knocking out and we're bathing the mouth in an antiviral, antibacterial, antifungal. Very effective within 30 seconds, antimicrobial. So that way the aerosols that we're producing, there's not going to be, the theory is there's not going to be as many live virus rather than using, distilled water or sterile water or what have you, which has nothing in it. I want to be bathing the mouth at the source with an antimicrobial. So we also have facility we have facility upgrades that we did with air purification systems, extra oral suction units and things like that. But I want to get it also at the source before it becomes an aerosol and there's active virus, floating around in the air.
So let me ask you as I close on this. When you put it in the water bottles, and obviously that's pumping through your hand pieces and all that other stuff, are you diluting it? What are you doing as far as, are you not putting any water in? What's your concoction, so to speak?
So to make it simple, I mean, they make the RTU, which is a ready-to-use rinse, 100 parts per million.
Right.
They make one that's a cinnamon flavor, but the cinnamon flavoring is in a separate vial. So
Right.
we don't add the cinnamon. We just have it unflavored. We pour it directly into the reservoir bottles. So nobody has to do any mixing or, like getting the correct ratios. That's 100 parts per million. And we just use it directly, pour it directly into the bottles. It makes it easier
How
that way.
long does that last?
In terms of how long is it active?
No. In the water bottle, I mean, do you go through it every day, like 3 water bottles a day? I'm just curious.
Oh, I mean, it depends on your volume of patients that you're seeing and how long your procedures are. I mean, it just like when you fill your water bottle for a hygiene patient, like how many bottles do you go through normally in a day? That's what you would be going through with this.
Okay, let me ask you though, if you're frugal, could you use the concentrate in your water bottle and mix it that way?
You could do that. That would be like yes, the Iotech would have to go over, the correct ratio to be able to get it to the 100 parts per million.
Right.
When they did studies, they did some in vitro studies, on many viruses that, coronavirus, an earlier strain of it, killed it in less than 30 seconds. The rhinovirus, norovirus and things like that, influenza. That was all killed in less than 30 seconds. So that was at 25 parts per million, and 300 parts per million. So, when I'm talking about 100 parts per million, that's 4 times the amount that they tested it in vitro. And the reason why I'm doing 4 times is because, you're putting it into a bioburden where there's blood, there's saliva, there's the bacteria biofilm and things. So, I feel comfortable having a higher concentration. So if you're frugal, you could buy the concentrate and dilute it, out to make those kinds of dilutions, and that way you're buying fewer bottles of it. And the way I look at it is that this is the cost of doing business now with, in the age of COVID, especially, So I contacted.
I'd add it to your PPE fee. Absolutely.
Exactly.
No doubt.
Exactly.
Ari, I can't thank you enough for being on the show. I learned, I'm sure our audience will learn. You've been great. I wish you the best and enjoy your holiday.
It's my pleasure. I look forward to more people utilizing it because it really can help a lot of people. It's a great thing.
I hear you. Thanks again. I really appreciate it. Take care. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.